Nowadays, we are managing patients after acute coronary syndromes with antiplatelets.
Yeah.
The antiplatelet therapy is the standard of treatment in patients after acute coronary syndromes, combining aspirin for all the patients with the P212 inhibitor.
Yeah.
However, around 10%, or probably 10% of patients are, with this combination, are still suffering new events within the next 12 months.
Yes.
So this is a clear unmet need in our knowledge, and something should be tested exactly to try to solve this problem.
So at least 10% in the first 12 months,
Yes.
and from Pegasus we know even after the first 12 months these events continue. Right, so what was tested in GEMINI ACS?
In GEMINI is tested a clear new concept. You remember that a few years ago, an interesting trial, Atlas ACS2, tested the combination of a low dose of Rivaroxaban, a very low dose of Rivaroxaban, 2.5 milligrams twice daily, combining with the standard treatment of aspirin plus P212 inhibitors, showed a clear reduction of events.
Yeah.
Of course, with some price was paid at that time with increase in mortality, there is a clear benefit of this combination.
So there was a decrease in mortality and cardiovascular.
Decrease in mortality, absolutely.
Yes, there was.
Absolutely.
Okay.
For the first time, for a long time ago, a trial showed reduction in mortality with the oral agents after acute coronary syndromes.
Okay.
So in GEMINI, this concept was tested, and was tested with a new thinking. Why? We need aspirin in these patients. So this is the question for GEMINI. And we know from in vivo trials that the combination of P212 inhibitor plus Rivaroxaban could be so good regarding thrombosis and antithrombotic effects as the antiplatelet therapy. So in GEMINI, this combination of low dose of Rivaroxaban, 2.5 milligrams twice daily, was tested combining with the P212 inhibitor without aspirin.
And half of these were on top of Clopidogrel and half Ticagrelor, 1,500 in each, I understand. So what was found?
For me, this is the most important part of the trial, because in Atlas ACS2 trial, all the patients were managed at that time with Clopidogrel.
Yes.
And Ticagrelor is the standard of treatment per guidelines,
Yeah.
is the standard of treatment nowadays. So in GEMINI, it's particularly interesting that half of patients were managed with Clopidogrel and the other half with Ticagrelor. And the combination of Rivaroxaban in low dose Rivaroxaban plus Clopidogrel or plus Ticagrelor show the same risk of dual antiplatelet therapy regarding bleeding. This is a phase 2. This is a class 2. Sorry,
a phase 2
it's
trial.
A phase 2 trial.
Yeah.
So the trial was designed to test bleeding risk, to test safety, not to test efficacy, and the primary endpoint was TIMI non-cabbage major bleeding. And the data showed that the two groups are absolutely equal, and there is no interaction.
So similar.
No interaction when you look at this.
So similar, but we can't say it's not inferior because
Yes.
it was not fully powered
Yes.
to do that.
Absolutely.
So is this going to replace aspirin or not yet?
Not yet.
Not yet. Not
At
yet.
my knowledge, not yet.
But
we are moving very fast.
And one of the things that's in the publication, but I don't think we heard in the slides today, was the combination of the Rivaroxaban and Ticagrelor increased bleeding.
Yes.
Significantly.
There is
So that's a warning
interesting-
signal.
It's an interesting interaction, but Dr. Magnus Zoman also showed in the presentation today that there is also an interaction regarding country.
Okay.
So there is something strange
Something else going
in
on.
this issue. We should look in more carefully for this issue. But in principle, there is an interaction when you look at the Ticagrelor, more rate of bleeding with Ticagrelor, but should be better explained when you look at this interaction regarding country.
Okay, so an interesting study, but not yet time to change practice.
Of course not. So I'd like to see a large clinical trial testing this concept in a large proportion of patients, a phase 3 trial.